We'll continue our review of gross anatomy with a discussion of the head and neck. We're going to limit our discussion of the head and neck to those areas not counting the brain, because, of course, the brain is going to be discussed in detail in the review of neuroscience. So what we will be looking at is the cranial cavity that will house the brain, the cranial nerves that exit from the brain, the meninges that surround the brain, and then we're going to spend a fair amount of time discussing some embryologic issues relating to the development of the head and neck, specifically the pharyngeal apparatus, and then related to that will be the development of the face and palate. So let's start off by looking at the cranial cavity. When we look into the cranial cavity, we see that the cranial cavity is divided into three regions, or three cranial fossae: an anterior cranial fossa, a middle cranial fossa, and a posterior cranial fossa. Sitting on the floor of the anterior cranial fossa will be the frontal lobes of the brain. Sitting on the floor of the middle cranial fossa, in the lateral portions of the middle fossa, will be the temporal lobes of the brain. And in the midline of the middle fossa is the pituitary. And then on the floor of the posterior fossa, we have the brain stem sitting in the anterior portion of the posterior fossa, medulla, pons, and midbrain. And then occupying the rest of the posterior fossa, we have the cerebellar hemispheres. Take note that the occipital lobes do not sit on the floor of the cranial fossa. It is the cerebellum that sits on the floor of the posterior fossa, with the occipital lobe sitting above that, separated by the tentorium cerebelli, the dural shelf. When we look at the floor of the cranial fossae, we see that there are a whole bunch of openings, each of which is important because there are nerves and other structures that pass through them, and we need to know which structures pass through, which nerves pass through which openings. So in the anterior fossa, we have this region near the midline known as the cribriform plate. The cribriform plate has multiple openings in it, and what passes through those openings are the multiple olfactory nerves, the olfactory nerves. Don't confuse olfactory nerves, which are cranial nerves, from the olfactory bulb and olfactory tract, which are parts of the brain that actually sit upon the cribriform plate. But emerging from the olfactory bulbs and passing through the cribriform plate to get into the nasal cavity are the fibers of the olfactory nerves, cranial nerve 1. Passing posteriorly into the middle fossa, we have the optic canal, and passing through the optic canal is the optic nerve, cranial nerve 2, but also the ophthalmic artery. The ophthalmic artery is a branch of the internal carotid. In fact, it's the first branch of the internal carotid. The internal carotid comes up through the neck without giving any branches, and the neck enters the cranial cavity, and then before reaching the brain gives off the ophthalmic artery that enters the orbit through the optic canal. Lateral to that, we have the superior orbital fissure, which has a variety of structures passing through it. The nerves associated with the extraocular muscles, cranial nerves 3, 4, and 6, oculomotor, trochlea, and abducens nerves, all pass through the superior orbital fissure, and also the ophthalmic division of the trigeminal nerve goes into the orbit the same way. And accompanying all of that, we have the ophthalmic vein, or the superior ophthalmic vein, which is actually the anterior continuation of a dural sinus that we'll talk about, called the cavernous sinus. The anterior continuation of that cavernous sinus is the superior ophthalmic vein, which enters the orbit through that opening. Slightly behind that, we have the foramen rotundum, which has the maxillary division of the fifth nerve going through it. And then posterolateral to that, we have the foramen ovale, which has the mandibular division of the fifth nerve passing through it. Posterolateral to that, we have the foramen spinosum, which has an artery coming through it. It's the middle meningeal artery, Remember that that artery is coming up into the cranial cavity. It's not exiting the cranial cavity, but rather it's entering the cranial cavity to supply the bone of the cranial cavity and the dura. Now, when we look at the floor of the middle fossa, we'll typically see these grooves, and one of which is illustrated here. There are usually multiple grooves that seem to radiate away from the foramen spinosum. And those grooves are created by the passage of these branches of the middle meningeal artery. So when the artery comes up through the foramen spinosum, it then quickly branches into these multiple branches that sit right up against the bone, thereby creating these grooves in the bone. The reason that's an important thing to remember is that this region, this lateral region of the skull, is relatively thin and is easily fractured. And because the middle meningeal artery sits right under the bone, held tightly against the bone by the dura mater, those branches are subject to being lacerated and bleeding. And we'll talk about that in a little while. More posteriorly, we have an opening that's called the foramen lacerum, but the important part of the foramen lacerum is the most medial end of the foramen lacerum, which is also called the carotid canal. And what passes through that is the internal carotid artery that comes up into the cranial cavity through that opening. Passing into the posterior fossa, we have the internal auditory meatus, which contains cranial nerves 7 and 8, facial and vestibulocochlear nerves. And then more posterior than that, we have the jugular foramen, a very large opening, which has 3 cranial nerves going through it, cranial nerves 9, 10, and 11, glossopharyngeal, vagus, and accessory nerves. But also going through it are 2 important venous structures. Coming in from the posterior side and going into the jugular foramen is the sigmoid sinus, one of the dural venous sinuses, which would be sitting right here. And from the anterior side, we would have the inferior petrosal sinus. Those 2 sinuses pass through the jugular foramen, and when they emerge from the other side of the jugular foramen, they fuse together, and once fused together, they're now called the internal jugular vein. So the internal jugular vein doesn't go through the jugular foramen, but rather the 2 sinuses that create the internal jugular vein are what pass through the jugular foramen. Next, sitting on the anterior lip of the foramen magnum is the hypoglossal canal with the hypoglossal nerve going through it. And then lastly, the large foramen magnum with the spinal cord coming up through that to become continuous with the medulla. And remember that along with the spinal cord, we have the spinal contribution to the 11th nerve. The spinal accessory nerve comes through there, and the 2 vertebral arteries. So the blood supply to the brain gets to the brain by way of the 2 vertebral arteries that come through the foramen magnum, and they largely supply the brain stem, the cerebellum, and the occipital lobe. And then the 2 internal carotid arteries that come through here, and they primarily supply the frontal lobe, the thalamus, and the temporal lobes and parietal lobes.